So, the private insurance has certain, to gain the profit. Private insurance are the profit making firms, they are not doing it for the charity. So, if the private insurance companies are into the business, so they have certain incentives. Yes, and they have to be in the competition, they have to follow certain strategies. Now, what are those strategies? So, strategies of private health insurance companies, or I will write private health insurers. Strategies of private health insurers. So, what are the strategies they play? Number one is they will charge higher premium and they understand that higher they charge, lesser they are their, or fewer are their customers. But they do not mind, even if they have fewer number of customers, they will charge high, but they will say we will cover all these things. In fact, nowadays certain insurance companies are coming to your home or doing some basic health checkups at the home. How customizing they are making, it is very, very high. The charge, the insurance premium is very, very high. They will come to your home, do the basic tests, all these basic health checkup tests they will do at the home. They will give all the apparatus, and not everybody can pay that amount, So they have a very less amount of customers, but they don't mind. They are making their premium high, and then altogether their revenue is high. So this is number one. Number two, charge higher co-payments. Charge higher co-payments. So this is one way to make your, so one thing is that you earn more here, and the other thing is that by charging higher co-payment you are actually decreasing your expenses, because if 1 minus Cx, so it is like decreasing expenses, because if you pay 20% of 80% of X, that means 20% is co-payment, is always always higher than if you pay only 70% or even 60% of X. That means 40% are coming from these patients of co-payment, are coming from the patients. If you are paying 60% of X, your indemnity summation 1 minus C into X is actually lower. So your expenses is falling. So either you increase your revenue here or you decrease your expense here. So here increase revenue, here decrease expenses. Both the way you are finding your way to make profits. Yes, and the third one is, so over here they will again get fewer customers, but they don't mind, because they will try to get those who are healthy, and then they think okay fine, and then they will keep the premium low here. They can afford to keep the premium low here, because in the second case, premium low here, because they, by keeping the premium low, they are encouraging those who are probably the healthier one, educated one, young ones, and at the same time, even if people look that okay, as a customer I need to pay a lot when I am going for the claim, but they also think that at this young age I am not going to charge for ask for any claim, I am not going to fall sick really. So why should I really pay a higher premium? So I will pay lower premium, and as I am not paying, I am not going to pay for any hospitalization in near future. So even if it is 40%, 20%, 60%, I really don't mind, because I am not actually paying anything at the end of the day. So my total premium is actually what I am paying, and that is important, that I am keeping it low. Yes, so it's a win-win situation again for both of them. Number 3 is cherry picking. In cherry picking, they will selectively find only those who are healthy or young or educated or working with the formal sector. So picking, like when we are given a cake, we'll try to pick the cherry, everybody looks at the cherry. So that is the cherry picking. So these are the people who are healthy, right? And then they are not really going to ask for claims in future. So these insurance companies, they will just try to pick those cherries, those healthier people, so that they are not going to make any indemnities but earning the premiums. That is cherry picking. We'll have a detailed discussion on cherry picking. 4 is they will only cover low cost health cares. Or health services. So when they say that we will cover I don't know, where did I write? Anyways, when they say that we will cover it's not eligible. Yeah, qualified medical expenses. And if those qualified medical expenses, what they qualify, those the diseases they qualify under a particular insurance, if they have kept them as low cost ones, so they don't really cover the treatment costs for cancers. They really they don't cover treatment cost for a complicated heart surgery or a brain surgery, which costs high. So their expense is again low, because only they will cover for those where they will, the claim will be some chota mota amount, the small amount. So they really don't bother. So these are the 4 ways where either they are increasing the revenue or they are decreasing the cost to make a way towards profit. Therefore, we will now look at this cherry picking. So what this cherry picking says, that find healthier patients and sell insurance only to them, to those who are healthier. Yes, sell your insurance. Okay, I'll write find healthier people and sell insurance only to them. Yes, next one, this is known as cherry picking. So what they do, they will find the healthier people who are educated, better jobs, younger, and better jobs with formal employment status, and with an organization where they have a possibility to do, where there is a possibility to have great group insurance. Group insurance. Now this group insurance means, say they go to Infosys, or TCS, a huge number of young people working there, all educated, young, working with a formal employment status, and then You approach the HR at TCS or Infosys that I want all these 200, 200 young people who have joined you this year, I want to insure them, right? So you give a group insurance with a lower premium, and all these 200 you join your customer base at one go with not much effort. Yes, and that's your, all our cherries for you. You are not going to pay for them in near future. What you can do a bargaining. You can say, if the company is also paying some part on behalf of them, you can say, okay, we are keeping the premium low. And eventually you can offer a lot of health services. Under group insurance, if I can go for a pregnancy coverage, I can't gain it. I have to pay. And when I asked that can we get a pregnancy coverage, then my insurer said, yes, 3 years your wife cannot be pregnant and you have to pay some 15,000-16,000 rupees, and only the 4th year, and that only covers those 3 days or 4 days hospitalization or the delivery package. Often they don't cover if the child has to go for an neonatal intensive care treatment, NICU, they don't cover that, or anything beyond these 3-4 days, they generally don't cover that. No, again, it differs from policies to policies, but generally, they don't cover the entire 9 months pregnancy treatment, only those 3 to 4 days. And for that I am paying 45,000 rupees already. Maybe with that insurance I can go to a top class tertiary care hospital, and again, pregnancy is not a disease, so nobody actually bothers about that, whether they will put 4 balloons in my car when I am getting my baby to home. But this is how they are segmenting the market. At the same time, not everybody, those are insured, are being pregnant immediately. So 8 years, if a person joins in 21, 22 at the age, if a male, so 8-10 years they are not asking for a pregnancy coverage. So, and if you have put some amount for that pregnancy, so it's again, it's an accumulated benefit for you for that long term. Eventually, doing this cherry picking, finding only healthier people, educated young people, there is a serious negative, effect. What is that negative effect towards the society is, I am leaving the sick people, the elderlies, poor, or those who do not have formal employment, out of insurance. And this out of insurance is making them vulnerable to poorer health, creating a death spiral. Yes, so, and again, finally, but they are again profit making institute and being a private health insurance. If they don't do that, then they will be paying a lot for this, and then certain section they have to do a cherry picking. And if they continue, insuring a higher proportion of the sicker people, they are going to go out of the business, because the premium they cannot keep high for those who have retired, for those who are poor, for those who are uneducated. Their health seeking behavior will be poor, they will have a higher vulnerability to fall sick, higher probability to fall sick, and then when this probability to fall sick increases, my indemnity increases. And if that indemnity, who will cover that? Those who do not have a higher probability to fall sick, the young ones. And then the best strategy to find those young healthier ones, educated ones, is to do cherry picking. So to be in the business, you have to do a bit of cherry picking. You don't have any other option. But how I generally price this, the cherry picked people, that I understand that they are healthy and they don't really expect too many things that you okay, I cover you this, I cover you that, they will say I don't require them. They are young, they are healthy, so they are educated, they have a better knowledge about the health system, health seeking behavior and all this. So they will say that I don't require that. So how will you allure them? So the number one, when we talk about the pricing, the cherry picking, then what we do, the first one is lower the premium rate. That okay, fine, you just pay, otherwise I charge 5,000 rupees, so you just pay 3,000 rupees or 2,500 rupees. And then they say okay, fine, I can pay, nothing, I don't know what happens, this is really uncertain, accidents may occur, so I can go for your insurance if you give me a lower premium rate. And the insurance companies also know that even if they go for individually, that these people are not going to ask for any claim immediately, and if it's a group insurance, they can further decrease the premium rate. The second is that group insurance. Okay, before this I will say that they don't mind higher co-payment because they are working well, they are young, so don't mind higher co-payment. So keep the co-payment high. So keep the co-payment rate high. Yes, and third can be group insurance. Yes, for group insurance for an organization. Yes, so to cherry pick, what we do, lower premium rate and higher co-payment. This is how we fix the price of a particular cherry picked customer. In order to do cherry picking, we have to do one thing, just to reduce my probability to pay them higher, just to have a better idea about the profile of my potential customers. Often in terms of group insurance, these health insurance companies will pay the organization or the HR, or will pay themselves for the health checkups. So every year there will be an additional health checkup which will be paid by this health insurance company. So that health checkup is known as experience rating. Very, very important. Yes, by this they learn that history or the medical history or the health profile, that how healthy that person is. Even nowadays, with the sedentary lifestyle, with higher prevalence of drinking alcohol, smoking, not much of exercise, too much of fat consumption, ready-made food, we have moved to a sedentary lifestyle. And then what is happening with this kind of nutrition transition, where our diet has really shifted from cereal to kind of this fat-based, sugar and salt-based diets. We are more prone towards this overnutrition or lifestyle oriented diseases, that is cardiovascular diseases, cancer, type 2 diabetes, so this at a very young age. So the health checking of a health profile is very, very required, even if we are going for a well-off or well-to-do this young person. And then once we are doing this health profile or experience rating, how does it help us? It gives us that the discretionary power where we can charge a higher premium from the sicker patient, where I can cover my risk towards paying that patient higher in near future as I was expecting otherwise, or have no coverage for some pre-existing condition. That okay, I already have cholesterol, so they may not consider some of the diseases related to cholesterol. I have a high obesity, so they may not consider. And the insurance systems are allowed to experience rate, they will if they are, but in all the cases the government sometimes they say that the insurance companies are not allowed to do experience rating in that way, because they will leave, the insurance companies will leave the sicker people out of the insurance. They won't sell the insurance to them. So the government in some cases they can pass a bill that the insurance companies are not allowed to do experience rating. That is illegal or logically wrong. So the government can insist for a community rating. For a community rating, that rather than rating individual patients or individual customer, you can experience rate for a particular community based on their 1 year profile or 5 years profile for that geographical location, for that socio-economic condition. Thank you.